Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Join Dr. Tom Roselle for a movie viewing of Ageless Health, the special. Ageless Health is a hard-hitting documentary based on the modernization of holistic health, natural care, and integrative medicine. You won't want to miss this Emmy Award-nominated documentary film. Proceeds benefit Caring for Others, Ltd. Ageless Health, the special, showing at the Bowtie Cinema 11 at Reston Town Center on Sunday, March 23rd at 2 p.m. For tickets and more information, visit agelesshealthmovie.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome, Dr. Tom Roselle Live. This is Dr. Matt Adams, a little different voice than you're used to. Dr. Tom Roselle is down speaking in Dallas, Texas, to my chiropractic alma mater at Parker University. So he sends his sentiments up here by sending a fellow Texan to come and speak with you today. We have a fantastic topic today we're going to talk about, and something that I think a lot of us are probably needing to hear about. We are having all kinds of interesting weather coming through. We've got snow upon ice upon snow, and a lot of us are still rubbing our aching joints and our bones from shoveling snow a couple weeks ago, and now we've got more things coming up. I was looking at the weather. Last I heard, we have 100% of, I saw ice pellets. So it's going to be interesting. And so we need to talk about some of the things that are causing this achiness in our joints that we're still reeling from. And I have a doctor, a fellow friend, a colleague with me to talk about this. His name is Dr. Scott Lamp, and he is going to be presenting on Wednesday, March 5th. At 7:30 that we need to come and talk with him and listen to his topic on arthritis. Dr. Lamb.
Good afternoon, and hopefully we survive Snowmageddon as it's coming in number 2, phase 2. And this is an interesting topic that you think about some of these things. You know, you always think that this is almost like an old person's disease. 60, you know, I'm over 60, I might have some of these things. But this is a disease that has a couple different factors to it. One being there's a wear-down effect. We have that, we call that kind of like osteoarthritis. And then we have another ones, and a couple of ones like rheumatoid arthritis. There's psoriatic arthritis. There's some other forms of arthritis there that have an inflammatory, strong inflammatory part of it. So, you know, we've got a lot of things to talk about.
Yes, and if you want to talk about that, or if you've tried some of these things, if you've got problems and nothing's really working, well, you know, here's your opportunity to find out what can make a difference without drugs or surgery. Give us a call here at 888-630-9625. That's 888-630-9625. Now, you made a comment about, you know, arthritis being not necessarily an older person's disease. Now, that's what we usually think. We usually think, okay, I'm not thinking about arthritis when I'm younger. I don't have any pain. Then all of a sudden, we think of arthritis. We see somebody struggling to walk around the grocery store or move around.
Right.
But what do you mean by that?
Well, for example, if I have an injury as a young person, especially like a teenager, and I have a particular injury, maybe like a knee injury, I'm going to actually use my wife, for example, who's hopefully she's listening. She was an elite gymnast, and one of the things that happened with her was there's a lot of pressure put on the wrists. And even today, she works in the healthcare field. But one of the things is that sometimes those wrists do bother her because of the fact of the wear and tear that's been done on them. So what you'll see is maybe about 10, maybe 15 years, maybe earlier, you'll see some things, a degeneration or breakdown of the materials of the body after like an incident like that. So in your 25, 30, you say, oh, wait a minute, I feel older than I'm supposed to be. Why are my knees giving out and I'm at 30 years of age or 28 years of age? So there's it can be a traumatic aspect that can be associated with this. And what happens is the growth plates and parts that are in between, and we'll get into, I guess, the parts of the body that are responsible with this, that they kind of don't function as well. So what happens, and there's alignment problems start to happen, and then all of a sudden the muscles don't balance, and all of a sudden next thing the alignment is off, and all of a sudden I got this wear and tear happening to my knee or my wrist in the case of my wife, or the knees in the happen of like an injury in regards to like a sports injury, like a soccer injury to a knee.
Yeah, no, I've experienced the soccer injuries. I've had operations on my left knee that for years didn't give me problems, and now I'm, can kind of feel it here and there with the weather here and there too. And but that's the thing about arthritis is we don't really think about it until pain sets in. I always call it the pain's the great motivator. But if we've had traumas, we've had things in the past, even though we don't have pain, most likely, like you said, if the joints are out of alignment, that wear and tear sets in, but we don't even notice it until the pain comes in. It's probably been there for years and years, just building.
Yeah. We have the things I always talk about. We have the conscious mind, the unconscious mind, and the unconscious mind is the smart one, the conscious mind is the stupid one. And it's the unconscious mind is the one that's like, okay, we'll handle this. We feel until the unconscious mind feels, okay, this is bad enough to tell the conscious mind to do something about it. But that could be years before that happens. And there are very subtle clues that can happen too along the way that we just kind of ignore. Maybe a click here and there, a little stiffness when I get up in the morning, and you don't think too much about it, and then eventually it kind of creeps up on you. And again, I don't also throw out the aspect too is as we get older, the more and more compensations that we do have. And there's things like, for example, let's say sitting in bad postures for a long time too. It doesn't have to be a major injury. It could be, let's say, sitting at a computer desk for 5 or 6 years or 7 years. Add that with, let's say, some type of trauma, maybe a motor vehicle accident, or just the posture itself. And all of a sudden I start getting these aches and pains, and there's compensations, and all of a sudden the body can't deal with it anymore, and all of a sudden you get pain. Yeah,
that sounds like pretty much anybody driving around here. I think most of the people here work at computers, sit in their car for long periods of time, and if they've spent any time on 95 and 495, there's a possibility of an accident that's been involved at some point.
And let's not forget about what stress does on our joints, too, after a period of time, sitting in the road rages we have a little bit out there, too.
Oh, yeah. How many of us come home rubbing our necks and our shoulders after just a stressful day? So, yeah, there's a lot that's causing that, and that's bringing up. Now, a lot of times we'll get this pain, and it's bothering us, and so people are thinking, well, I'm going to take some Tylenol or some different like drugs,
steroids,
things like that to bring it down. So it does seem to help the pain sometimes. Well, what's really happening though?
Well, I think one of the things is when we take some things like NSAIDs, non-steroidal anti-inflammatory medications, we're looking at something to kind of stop there's kind of like acts like a hormone, prostaglandins, and they're responsible for some pain, but they're also responsible for anti-inflammation as well as inflammation. And so what those things do is they have a tendency to stop the whole process and kind of mask the pain. The problem is over a long period of time, your body doesn't heal with that. And you're really not supporting the anti-inflammatory pathways, and that gets into like things like omega-3s and the essential fatty acids and stuff of that nature. So over a period of time, you can actually have a little bit more destruction. It's one thing to drop the bowling ball on your foot and then take an aspirin of some sort, and then, okay, I feel better. But if there's a displacement or some other problem, and you keep on taking that aspirin for months and months and months, you're not going to the cause of the problem. And you need to go back and look at some nutritional aspects. You got to look at some aspects in regards to the structural component of the body, and even some emotional parts. We'll get into that probably a little bit later, to really kind of work and heal that spot. So, and then the other thing is what's the side effects? I think when you look at something like Tylenol or some other drugs, where's the filtrations in our body when we have these drugs? We got things like the liver and the kidneys having problems. Kidney is one that's very susceptible, and I think when you talk about 20% of the people that are on dialysis are associated with NSAID drugs.
Yeah, so there's a whole lot we're going to discuss. There's a lot of parts of the body involved in arthritis, and Dr. Lamp is, again, doing his presentation at the Roselle Center for Healing at March 5th. That's a Wednesday. Give us a call. Give the office a call, 703-698-7117. Again, that's 703-698-7117. Tell me you'd like to attend. Tell me you want to be there. It's all by appointment because it fills up quick, so that you can listen to more in-depth understanding and breakdown of the arthritic problems that are going on and how we can help it.
Yeah, things to do. Things to do, and things
not to do.
Right.
So we're talking about the cause. That's something I want to focus on right now. Is pain is there to warn us and tell us there's a problem. And a lot of times we are in pain and we take something to hide the pain so we can keep doing the things that we're doing. But that pain's there to tell us, hey, something's not in the right position. Something's not moving right. We need to fix this. And so we end up hiding that and just keep doing the damage that our body's trying to warn us about.
Yeah, and again, there's many aspects that happen here with this, and I think let's talk about what the players are in part here. You've got a joint, which are two bones, and usually when you say arthritis, arthro means of the joint, and also itis means of inflammation. Arthro, you got two bones together, you got some ligaments in there, you have something called synovial fluid, that's that slippery stuff that makes things glide really well. You've got cartilage, which actually helps hold water in there, creates a cushion. And a lot of times what happens when you think about arthritis, that cartilage starts to break down. Sometimes we get bone on bone. We get maybe possible bone spurs that might form in that kind of aspect. The other interesting thing, too, is you got an arterial flow. You got an artery that feeds that area. And cartilage sometimes doesn't have direct access to a direct artery itself. You've got this kind of like nutritional bath. So that every time you move, you squish that cartilage back and forth, and it feeds itself that way. But if you don't move, you don't feed it. And one of the things that happens, especially in the United States, we see a lot of things in regards to hip problems, especially there's, I guess in Asia, when you go there and you go to the bathrooms there, and they have in the more popular area, they're going to have Western bathrooms. In some of the not so popular areas, there's a hole in the ground, and a lot of people in the United States can't squat to use that little hole because the cartilage is starting to go in their hip joints. And I think the thing is one of the good takebacks is to be able to feed that joint. And one of the kind of the ways to treat it is you got to get full range of motion. You got to get the whole hip to move, which is a circular kind of like it's like a ball and socket. And if you only work the ball and socket one way, just let's say walking and not doing side-to-side movements or other movements or global movements, some of the cartilages can start to die. So that's an important part in arterial flow and also getting that water and things that are in there.
I get some oil in those joints. Reminds me of the Tin Man from The Wizard of Oz. You notice once they oiled him up, they never had to oil him up again. He was oiled up and he was moving the whole time.
And he was using omega-3s and essential fatty acids. That was in the oils.
That's right. So yeah, I actually have a stat from Tufts University where it says they had people come in with arthritis, and there was a 43% dip in pain with strength training. And a lot of times you think, well, I'm hurting arthritis, I better not move because my body's telling me not to, it's hurting, but actually moving is what's going to help it get better and feel better.
Right. Movement and alignment, too, is important, too, because if it's aligned correctly. My analogy that I usually like to think of is like a car. And if I had a car and I've got my wheels on my car, and they're destined to have a certain amount, let's say 100,000 miles on those wheels, but if my alignment goes off, what happens to the wear and tear on the tires? They start breaking down more. Then the other thing we have in this country, we have a lot of problems with obesity and actually excess weight. So if I put more weight on that car, that's going to be more wear and tear again on those wheels. And so we got to look at taking alignment off. You got to look at taking the pressures off. And then there's a whole bunch of things, like there's a whole bunch of nutritional aspects. And especially when we talked about cartilage before, and it actually attracts water, you need to be hydrated. And a great majority of the people we have are definitely dehydrated. So that's one of the things you can actually start off right off, is making sure you're drinking an ample amount of water. Yeah,
water is so important. I preach that to pretty much all of my patients. There's so many problems from joint pain to other illnesses that water makes a huge impact on. Once again, we are talking arthritis today, and our presenter here, Dr. Lamp, our special guest, will be talking about this March 5th at the Roselle Center for Healing. Give them a call, please, 703-698-7117, to help you get over that shoulder irritation from shoveling your snow.
Or your knees. The knees are a big one.
The knees are a big one. We are coming up to a break right now for some very important information. Don't go away. We will be right back real soon.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Good afternoon. You're listening to Tom Roselle Live. This is Dr. Adams in here, spending some time to chat with you while Dr. Roselle is spreading his knowledge of health and wellness to the state of Texas currently. We are talking about arthritis, and I'm here with special guest Dr. Lamp, who is doing his presentation March 5th at the Roselle Center. So please come at 10. 703-698-7117 is the number that you want to dial to reach the office, to get your spot, to listen to him and learn about what we need to do about this pain that we're having. Now, let's talk a little bit about the different symptoms of arthritis. Now, we know arthritis, we think pain, but there's a lot of other symptoms that might be around even before the pain sets in or along with the pain that we need to be aware of.
Okay, well, I think one of the things is there's all elements, depending on what types of arthritis you have. You can have some swelling in the joint itself. Usually those type of, there's systemic ones, like if you have like a rheumatoid arthritis, psoriatic arthritis, some of those things can actually swelling in the joints. You could even have it with osteoarthritis as a secondary thing if you have some torque or irritation to the tissues around the arthritis area itself. You get some redness and some warmth. There's actually inflammation is a big one. The fatigue is another thing. It's a secondary element. Fever is another could be a possibility. All those can be thrown in there as possible symptoms that you have. You know, you think about being not moving for a little bit, and I think it was a doctor that told me at one particular time, arthritis is kind of like lard. If you let it sit, it freezes up. And if you move it or heat it up, it actually loosens up a little bit, and that's why I guess we got all these people going down to Florida and Arizona and stuff to retire. So that analogy kind of helps a little bit. Sometimes heat actually helps very well. But again, also if there's alignment, what is the issue that's causing that in the first place? And if you can reset the body, reset the alignment, we talk about on the chiropractic side of things, get the subluxations out, take the pressures off the nervous system. And think about this too. There's a lot of things with arthritis in the spine, and the nerves that play a part with that. And you irritate a nerve, the nerves will actually reflex back to the body and guard and sometimes lock things down and keep that joint locked. And that joint locked and maybe in a very cumbersome position that can actually cause more additional wear and tear, especially on things like our discs and those kind of things. And, there's some secondary things, too. We haven't even talked about the aspect of stenosis in regards to how that can have a great strong effect on our bodies. It narrows think of stenosis as like a narrowing of a tunnel, less area for the spinal cord to run through, or areas to where the nerves break off and come out from the spine. And the more and more fluid or inflammation that you have in those areas can cause compression and cause pain.
Well, yeah, and anytime we have pain, our body's going to respond to that by causing inflammation and swelling, because that's its natural way to send nutrients to the area to try to heal it. The problem is when we get, you mentioned some of the psoriatic and some of the other inflammatory arthritises, it just sits in there over a long period of time, right. And it never goes away, and over time it actually starts to eat away at the joint. Now, and there's also some lifestyle things that cause that inflammation to stay there or keep coming. Yeah, I
think with inflammation, one of those things is doesn't have to be from trauma. A lot of things that we eat for foods, and I think there's a lot that's out there with being gluten intolerant or gluten sensitivities that actually, I remember having two patients, and they were both fairly young. They were probably in their late 20s, coming in, and they said they had stiffness in their hands, and they're volleyball players and didn't like that kind of thing, and said, what's going on here? Take them on a gluten-free diet for 2 weeks, and all of a sudden, next thing you know, they're actually able to open up their hands. They're better to move. So some of these inflammatory byproducts can get into joints and accelerate irritation. So anything that causes inflammation, dietary aspects play a major part. And if you want to accelerate your process, you start picking up some of those pastries.
Yeah, what we call the standard American diet, or you break it down, the SAD diet.
The SAD diet.
The SAD diet. And we see that a lot. Unfortunately, there's a lot of retraining and rethinking that we have to do to help with a lot of these arthritic conditions.
Let me. There's an interesting aspect of stat here as I was looking at, and they were talking about for every pound that's added for, let's say, even dietary aspect with additional load on your body, takes another 4 pounds onto your knee. And they're talking about why women sometimes have more of a problem with arthritic knees than men do. But the thing is also there's a difference between the sexes. The females have a little bit wider hips because of the birthing canal, and there's a little bit more sharper angle to the knees, and that can exacerbate some of those things with extra weight and alignment and so on and so forth. So there's some differences between the sexes depending on what's being done and what's being loaded upon them.
Yeah, there's different angles, and that's a good thing to talk about, because we don't always think about and just like you talk about the alignment of a car. Once that extra weight goes into certain positions, and then it causes the joint to not move the way it's supposed to, and then over time it keeps rubbing, and then like you said, you get stiffness because the muscles go, hey, we got to support this area. Let's just stiffen all the joints up so they don't move, so it doesn't hurt. Then over time, that stiffness sets in, it gets stuck, and then we get more arthritis building. So we get this, vicious cycles that keeps happening.
Right. And I think this is like, motor vehicle accidents. We'll see a lot with somebody getting into a whiplash aspect and 2 to 3. And if you take an x-ray of that person right at that particular point in time, you probably, unless they have already previous arthritis, you're really not going to see arthritis. You might see some spasming of the muscles and changing the alignment a little bit of that. Maybe some ligament laxity. The ligaments get a little bit loose because of the fact of depending on the force involved. But you're really not going to see like the bone spurs or maybe some joint inflammation a bit, but you're not going to see a lot of damage until about 2 years later. where the joint spaces have been compromised, the alignment's off, the muscle stiffening that's been going on, the nerves are being irritated, exacerbate that with bad posture or guarding mechanisms, and all of a sudden you've got somebody who's like, wait a minute, it looks like they aged an extra 10 years on what's happened on their spine.
Well, it looks like we're going to have to take another break here. Once again, if you have any questions, give us a call, 888-630-9625, 888-630-9625. I'd love to talk to you. We'll be back here. We're going to take some time to pay some respect to those who bring you Dr. Tom Roselle Live, and we'll be back with you in just a little bit.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Hello, you're listening to Dr. Tom Roselle Live. This is Dr. Adams. We are here in studio live, and yes, you heard right. It's Dr. Adams, not Dr. Roselle. And once again, he is out in Texas spreading his knowledge to as many people as he can, and that happens to be Texas right now. We are discussing a topic that is very important. So if you are noticing that you have some aches and pains or some redness, or maybe you don't feel comfortable when you sleep at night, you came to the right place. Listen up. We are having a presentation on arthritis from Dr. Lamp here, Wednesday, March 5th at the Roselle Center for Healing. Please give them a call, 703-698-7117, to reserve your spot so that you can learn the things about arthritis, what you need to do, how you can feel better. And Dr. Lamp, tell us some of the things. What are some of the things you're going to be talking about at this presentation on Wednesday?
One of the things is actually some of the possible substitutes or complementary things in nutrition that could really be to really help with the aspect of the body, and also some of the therapies that we do in the office, and go a little bit more into what happens with acupuncture and how that kind of affect and kind of make that work a little bit better. Cold laser is a great thing to work with this particular type problem, and understanding that and going through and seeing and some demonstrations with it. The other thing, too, is also be testing people for pH work and taking a look at their inflammatory element. And what pH means is just basically, what's your acidity level of your system? Are you acidic or you're alkaline? And you've heard Dr. Tom in the past talk about things where if the body's acidic, it's breaking down. It's like if you throw acid on something on your skin, you irritate the skin. So if you're in an acidic state, you actually accelerate arthritis. You accelerate heart disease. You accelerate diabetes. You accelerate cancers. You accelerate all those kind of things. So we're really going to have a strong look at the dietary aspects, the things that are out there, what's good and bad, and kind of look at that element. Understanding some things, some basic exercises that we can also go through a little bit too to understand some alignment and some things. What are those good therapies out there that may be good for you, maybe not be good for you? And so we can talk about that. And we do have and actually when I do a talk, I usually have a very, very large question and answer afterwards that we talk about. So that's some of the things we cover.
Yeah, you mentioned the being acidic, the problems with arteries and how it can affect that. Well, what if somebody has health issues, like a heart problem or kidney problems or anything like that, your body's struggling to work with that system, and so it's causing probably some acidity, some other problems. What can we expect with arthritis? Is there a correlation? Can that cause even more problems?
Well, I think if we talk about cardiovascular disease, you've got a compromise of the blood flow to certain areas, and here we go again in the joint. Not only we talked about the joint and making sure that it's moving fully and freely all the way through to feed the whole joint. The second aspect is, am I even getting the blood there in the first place? And those things with diabetes, think about diabetes, sugar in the blood thickens it, these small capillaries that need to feed small areas, and sometimes those be compromised. And so when they get compromised, they don't feed the joint very well. Cardiovascular disease, if you got heart disease, so if you have somebody that's got heart disease and diabetes, you've accelerated the process, the possibility of having arthritis. And if I see somebody with arthritis, and there's a lot of decay, especially in the upper neck area, and I see some things like that, I'm looking, how's their blood work? How's the blood going? How's their diabetic aspects? This is a lab person that I need to take a look at a little bit closer and scrutinize their labs.
Yeah, there's a lot of intricate things that are going on in the body we don't always think about that is affecting the joints, the inflammation there. There's other things like some people will do hard workouts and or maybe not a hard workout, just a workout in the joints, trying to get it to feel better. But sometimes they feel worse, maybe they feel worse because they're really stressed. Maybe there's a lot of things that have to do with our adrenal system, from stress, not only stress from work or from home, but exercise stress, all kinds of different stressors that can affect the joints.
Well, things like mineralocorticoids that they're actually put out by the adrenal glands, and what they do is really affect the ligaments of how well we hold ourselves together. I remember having a particular patient over quite a few years ago. That particular one was a high-stress job. She had a high-stress marriage, basically gets into a car accident. After the car accident, basically she doesn't even hold herself together. Any type of little work, all her joints would hurt. Not her muscles, her joints would hurt. And so basically what happens with the adrenals is it actually gives you supplies to help hold ligaments together. And that's another thing. If I can't stabilize the joint's going to be wobbly, and it's going to try to figure out a way to get the muscles to spasm, to keep it placed together, causes, again, alignment issues. So the adrenals play a big, big part in regards to maintaining those ligaments and the integrity of the joint. And on top of that, the adrenals also put something called cortisol out, and it's a natural anti-inflammatory. And if that natural anti-inflammatory is not working, it's stressed out, it's burned out, there's nothing left in the tank, you can't heal well. So when you lift those weights and you put a little stress in those joints, it's supposed to be able to take that. But if it's not doing it and you're feeling sore after that, that's definitely a sign that those ligaments aren't holding up, the joints are being a little bit compromised. Generally, adrenal issues are one of the first things you want to take a look at.
Yeah. We see that a lot in this area. I'm not originally from this area in Northern Virginia, but since moving here, I've seen a huge correlation with the amount of stress and traffic and people's ability to heal. And there's a lot, and people say, well, I work, I've got kids, I go to school. How do I deal? I can't stop doing these things. Can't stop doing this dealing with this stress. But there are things we can do nutritionally and diet-wise to provide the nutrients, provide the vitamins and things that we need to handle that stress.
Very much so. And I think also don't forget we talked about the water element too. The water is important because of the fact of, again, making sure there's a balance and protection in the joint and the joint doesn't get decayed. The other thing is the supplementation that can be done. We got corticosteroids that are being used a lot and sometimes to reduce pain like that. But what happens is when you tell the body to turn on one thing, then the body will actually turn off another. And if you're on the steroids for a long period of time, you can atrophy the adrenals. And when you come off steroids, they usually tell you about taking it off slowly because you're trying to get those adrenals to recover. And so that's the side effect. You're also knocking down the normal element of the body to be able to help itself, and it gets very strongly compromised.
Well, let's go to the phones here. We have here Sylvia. Sylvia, you there?
Yes, hello.
Hello, Sylvia.
What's up, Sylvia?
What can we do for you?
Yes. I've had some pain, and I don't know if it's from lifting. I've been doing that with snow and a few other things around the house. In my neck, when I turn my head, I can't turn it all the way anymore. Just a little bit, and I feel it at the top of my shoulder and through my neck on the left side.
Now that sounds a lot about what we've been talking about. You have joints that are causing irritation to the nerve or the muscle, and it's going down to that shoulder.
Sylvia, how young are you?
85.
Okay. So, Sylvia, you might have there's some aspect of some arthritis probably in the neck. And so also when you talk about shoulder pains, allow those nerves at the base of your neck. If you go from kind of like where your throat is, your Adam's apple, and you go down to the base of the neck, probably almost down to there's a little notch right between your clavicles, your shoulder, your collarbones. Those nerves go down into your shoulder area, and you probably have a compromise of some sort that's there. And also, how is your posture? Are you?
My posture is good.
Okay. Do you stand upright? Does your head carry forward too much, or?
I've been told sometimes it does. I'm not always aware of it.
Okay. So that's one of the things that's very, very important is that when the head starts dropping forward, it's like the head starts dropping off a little bit of like a cliff. and it puts a lot of strain on the front muscles and the back muscles and starts stretching things out and puts a lot of irritation and kind of accelerate the arthritis aspects. There's a lot of the things that we can help you with. I think one aspect, this is like a chiropractic element very strongly. The second aspect is also trying to look at some type of nutrition to make sure that you can actually control some of the inflammatory aspects, and probably some good ergonomics to kind of help you with your lifting, and especially with the snow and everything else, how to lift appropriately. And so if we can get and what we usually find out is there's a muscle called the rhomboid. It's a muscle that sits around the back end of the back. Those sometimes get weakened, and the muscles in the front part of your body, like the pec muscles they call them, get shortened, and all of a sudden you start rounding your shoulders, so that can cause a lot of difficulty. The doctors here, I can help you here in the office. You can give it a call at their office at 703-698-7117. We can help you. That's something that's very, very workable.
All right, thank you.
All right, thank you, Celia. Please give him a call. We see that very often, and we can really help you with that, definitely.
All right, thank you.
Now, we have another caller waiting over here. We have Susan.
Yeah, hi.
Hi, Susan.
Hi, Susan.
Hi. I'm calling because I have problems with the fingers of my hands. What happened is like a quarter of an inch before the nail, it's red. But what really bothers me is the tip of the especially my left hand, is like needles. And it comes mainly, when it is cold, or if I go out and I don't put my gloves on. So I wonder what it is.
Now, Susan, is this all of your fingers on your left hand, or just one?
All of my fingers on my left hand, and also in my right hand, it's only the red of, like a quarter of an inch before my nails. But no needles, the tip doesn't hurt like that. But the left, yes, it does.
Susan, do you have any blanching of your hand? Is there any type we're looking for like a vascular type things that happen there too? There's a couple different things. Is it more of a tingling sensation? Is it more of an aching sensation? And does your hand kind of blanch a lot or swell?
When it started, it was itching terrible. Both. It was itching, but then the itching stopped. And the tip of the fingers became painful like needles.
Okay. So a couple different things here. One, I'm going to make sure it probably need to be looked a little bit more at, to see the vascular aspect of the arm going down that side, which is interesting. It's only one side versus another. When you have one side versus another, you might be thinking of more compressional problems that might be happening, a possibility that's farther up, anywhere up the arm. You have some entrapment problems that could possibly happen anywhere from the wrist. There's a pronary teres thing that possibly can happen. There's a pectoralis minor syndrome, and all the way up into the neck. They could actually have some compromise that can affect that long nerve that goes all the way into your fingers. And that needs to kind of probably take a look at. There's a couple different orthopedic tests that need to be done to evaluate to see how that is, and that's probably the best way to take a look at it for the time being. Mm-hmm. If you have a systemic type thing, it'd probably be more on both sides, but that doesn't necessarily rule it out completely. Yeah. But usually you got a one-sided element there, so you got to take a look at is it a vascular? There's things like Raynaud's, which would just be coldness in the hands. But it sounds like more of some type of compromise there on that left side of your hand, and that needs to be checked out.
Okay. Do you think I should see a neurology or orthopedic?
Well, you can actually see us. I mean, this is something we can work with. It's like all those doctors will look at that, but it's something that we look at, and we'll have a conservative approach on it and bring it in. But I think, again, when it has the whole hand involved, I'd also want to see if the hand's blanching. Is there some swelling? So is there a compromise in the arterial or the venous flow? And then I also want to check some of the nerve patterns and pathways. We can do that in muscles too. Yeah, joint.
It's not the whole hand. It's just the top of my fingers.
Top of the fingers?
The hand is okay, and the redness is about a quarter of an inch red before the nail.
Okay.
Like 1 centimeter.
Okay. Again, it'd probably be the best bet is just trying to kind of take a look at that and see it in office to see what you've got. It's probably the best way to take care of it.
Give us a call, 703-698-7117. Let somebody sit down with you and look at the hand, check some of the muscles, and check some of the blood flow, the pulses around it, and see if it is an arthritis thing, if it is a blood flow thing, if it's a joint thing, there's a lot of possibilities it could be, but we can definitely figure it out.
Right. It looks like arthritis because it's in the winter happen. I don't know. Well, anyway.
Well, yeah, give us a call. Let us take a look at it and figure it out. It's a little tougher on the radio to come exactly what it is, but I can promise you that if you give us a call, we'll be able to figure out what's going on and put you in the right direction and get you feeling better.
Okay. Thank you very much.
Thank you, Susan.
Thank you, Susan.
Yeah. Bye-bye.
Well, those were some good calls, and just like we were talking about, we've got pain with some people, we've got some redness with some people, itching, different things that are presenting with these arthritis conditions, and a bunch of things that you're going to be talking about with your talk on Wednesday. And once again, everybody, March 5th, Wednesday, 7:30 p.m., give us a call, 703-698-7117. We have to come over here to another break for some important information and some information from those that are helping bring you Dr. Tom Roselle Live here. We'll talk to you in a little bit.
This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
If you're looking for the best in natural health, wellness, and green living products, shop the Roselle web store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Roselle web store on Amazon.com today. Visit drtomroselle.com and click on Roselle Web Store. That's drtomroselle.com and click on Roselle Web Store.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series Video on Demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Welcome back to Tom Roselle Live. You are listening to Dr. Adams sitting in for Dr. Roselle while he's out in the sweet land of Texas. We are talking pain, we're talking inflammation, we're talking osteoarthritis, psoriatic arthritis, we're talking inflammatory arthritis, we're talking gout, all these things. That we are talking about these issues that cause us a lot of discomfort. I'm here with Dr. Lamp, who is your host and presenter at 7:30 March 5th on Wednesday at the Roselle Center for Healing. Give us a call, 703-698-7117 at the Roselle Center, and get your appointment so you can listen to this a very informative topic and get more in depth. We've only touched the surface here on the radio. Dr. Lamp, what are you going to be telling us about? What are you going to be talking about at this event?
Okay, one of the things is important to talk about the nutritional aspects, and there's a lot of things out there like glucosamine that's out there and chondroitin that's out there and combinations and some things, and talk about some of the best combinations out there, hyaluronic acids and those kind of things that can work well with the joint and how you kind of fine-tune them for the individual person. We're going to talk about what kind of blood values you want to take a look at to see. We're going to take a look at maybe some of the histories of things that might have been that might have made you susceptible to some of these aspects. folks. There's some interesting things with juvenile arthritis, or not juvenile arthritis, but rheumatoid arthritis in regards did somebody have a problem between the early ages of 5 to 6 on an emotional basis that sometimes can be associated with some of the things with rheumatoid arthritis, and also some of the elements of some of the critters that might be getting in their systems that might be causing some of these things. So we're going to go into a little bit more in depth than that. And we're also going to talk about certain types of therapies that you can do, not necessarily in our office too, the therapies that are out there, what kind of things work well, what things don't work well, what do you want to apply towards on your body, things you can take home to actually use and work and make it work for you. And some basic things in ergonomics we'll talk about too. So we're crossing over probably 3 parts of the triangle that Tom always talks about, and I like to try to do that with every particular case I deal with. Is what's the structural component, what's the chemical component, and what's the emotional component. And on the emotional side, you also have the adrenal. So we'll strongly go through that and what kind of medications, or not medications, but supplementations that you can take and to take to augment and to make things work better.
Yeah, as you can tell, there's a mouthful of information that we're going to be discussing. If you have problems, if you think you might have problems, if you don't think you have any problems, and you might actually still have some. If you know somebody that has problems, please come listen to Dr. Lamp.
This is for all ages, I think, too, to take a look at, especially if you're a younger athlete, too, and you've had some injuries, to take a look at and say, is there something that's going to happen to me in the future? Also, if we're up there a little bit younger in age, getting over the 50s and 60s, how can we possibly help to make sure we maintain a better lifestyle?
Yes, give us a call at the office, Roselle Center for Healing. Once again, it is 703-698-7117. Dr. Lamp here is going to be your host on arthritis. I go back and forth on information. He's extremely intelligent, really knows his stuff. Thank you for listening with us. Please listen here every Sunday at 12 o'clock noon for Dr. Roselle, Tom Roselle Live. He will be here back next week. So sorry you won't hear our voices again, but you can look forward to listening to him and getting the information, the health, the understanding, and how to help your body work better.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com. Join Dr. Tom Roselle for a movie viewing of Ageless Health, the special. Ageless Health is a hard-hitting documentary based on the modernization of holistic health, natural care, and integrative medicine. You won't want to miss this Emmy Award-nominated documentary film. Proceeds benefit Caring for Others, Ltd. Ageless Health, the special, showing at the Bowtie Cinema 11 at Reston Town Center on Sunday, March 23rd at 2 p.m. For tickets and more information, visit agelesshealthmovie.com.